My name is Tinpawee Thongkongthun, and I'm here to present the relationship between PM 2.5 exposures and hepatocellular carcinoma, a meta-analysis. So here, before I start, I would like to ask everyone in here, have you ever had a really bad day in your shift before? So please raise your hand if you have had a really, really long day in the shift, night shift even. Yay, okay, we've got some here. Right, so then I also experienced the same thing. And then the first thing that I want to do in my life is to get out of the hospital as fast as I can. And when I got out of the hospital, neither did I get like a really bad air. I also did cough because I found out that the PM 2.5 level that day was above hazardous level. And when I did the research, I have found that PM 2.5 levels are increasing worldwide. And it's not really happening only in Thailand, but everywhere in the world. So we all know that, well, PM 2.5 has a significant effect on our lungs. But what other systems does it occur? Does it causes like cancer or other things? So here, today, I want to present the relationship between PM 2.5 exposure and hepatocellular carcinoma. What we did was that we did a search from PubMed, MBES, and Web of Science, and we found 1,245 articles, which then only 9 studies met our inclusions criteria. Our inclusions criteria include the studies that provide data on PM 2.5 exposure, and the data, the requirement for the data is that it has to be like a relative risk, hazard ratio, along with the corresponding 95% confidence intervals per 10 microgram increase in PM 2.5. So the 9 studies that met our inclusion and exclusion criteria involve countries from all around the world in every continent. And the population exclude 500,000 people worldwide. And this is the results. So just to, just to make it easier, I like to highlight the incidence rate. The incidence rate. So for the pool odds ratio, we found 1.44. Pool risk ratio of 1.42, and pool hazard ratio per 5 microgram increase in PM 2.5 is 1.14, meaning that every 5 microgram that you are exposed to PM 2.5, there are likely a 14% chance of getting HCC. So there's a significant association between PM 2.5 exposure and an increased HCC incidence. Mortality rate. For the mortality rate, because there are really like limitation numbers of studies, so then the pool risk ratio was 0.79, but however, we found a strong consistent association between PM 2.5 exposure and increase in mortality risk. For the heterogeneity, it has confirmed the robustness of the results, and publication bias have found the funnel plot appears symmetrical. Egger's test, there is no significant publication bias as well. As for our discussion, so we have seen that the PM 2.5 exposure has increased and is significantly associated with the mortality risk, and also elevated the incidence as well, emphasizing a public health concern, which PM 2.5 contributes to carcinogenesis through oxidative stress, inflammation, and DNA damage through our research. And it also aggravates some of the liver conditions as well, such as hepatitis and fatty liver disease. It also causes chronic inflammation leading to fibrosis and also cancer progression. So here, I would like to do like a policy recommendations to enforce like a stricter regulations on industrial and vehicle emissions, promoting also the public awareness of PM 2.5 risk and preventive behaviors such as using like air purifiers, avoiding outdoor activities. But we don't really have to do that if we have like a better law. However, the limitation of these studies is that there are also like many uncontrollable factors such as when we are doing the mortality rate, and there are many variables, many adjustment variables, so it can really like direct it to the mortality increases. Here, I am here to conclude that PM 2.5 exposure is strongly associated with increased risk and also increased risk of HCC incidence and mortality. There are public health implications that I want to highlight the severe threat that is posed by this fine particulate matter, urgent need for stricter air quality regulations to mitigate these risks. And future studies if possible, should focus on PM2.5 exposure itself alone and the progression of the diseases. And I hope that everyone could have a better air without having to cough. Thank you.
Thank you for valuable information. Do you have any comments or any questions?
Thank you very much for your nice presentation. So I wonder about the outcome of mortality rate, that the results are conflicting between pool odds ratio and pool relative risk for the mortality rate. Yes, why the results are conflicting when you pool odds ratio and pool risk ratio?
I feel like
Do you try to explore?
Yeah, we try to explore, but I think it's because of the limitation in numbers of studies, because there are only like 7 studies and only like 2 or 3 studies that is included in mortality alone. Yeah, because there are only little research on this PM2.5 matter. Yeah.
Maybe you should explore about the study design and how to categorize high and low exposure to PM2.5 that may be different between study. Yes.
Right.
And I wonder that you pull adjusted risk ratio or you pull crude effect size.
We did the adjusted risk ratio.
You pull adjusted effect size for all odds ratio, hazard ratio, and risk ratio.
Yes.
Okay.
Thank you.
That's only the question. So I think we have no doubt about the PM2.5 with the lung, CA lung, something
Yes.
like that. But you can give any ideas that the relations of the PM2.5 and hepatocellular carcinoma in terms of cytokines or oxidative stress, or the way to think about the connection and connecting about the PM and this kind of the carcinoma.
Yeah, because PM2.5 is also like named as its carcinogen, and I can't really give names because I forgot already. But it kind of aggravates the inflammatory system, yeah, and it causes it to maybe more inflamed and more susceptible to other conditions. Yes.
For the future study, you can.
Yeah.
I think for suggestion you can find the correlation about the different kinds of carcinoma, because the pathway might be the same things.
Right.
Hepatocellular carcinoma, lung cancer, or any organs might be related.
Yes.
Good, interesting.
ขอบคุณค่ะ
Any more questions for our judges?
When you say about the mortality, you
Yeah.
mean like the
It's all cause
all
mortality.
cause mortality
Yeah.
for those who were already with the hepatocellular carcinoma, right?
Yes. But we did like a case control as well, and they included the studies. They included the patients who have like shine pube level, like certain shine pube level, and put it in like the same city exposure for a long time, and do like a follow-up periods of like the mortality. That is like as far as we can get with the mortality and the PM2.5 exposures. Yeah.
How many studies from this study that is like a prospective study
That is
and prospective
all
cohort
prospective.
study? Because usually in PM2.5,
Yeah.
the study is usually like an public level data. Are there any of this study who is like the individual level data? Like usually in other type of cancer, they usually do in like national database of claims, right?
Yeah. So I've take a look at my data, and all of it are cohorts. Yeah. But some of it is retrospective, while some is prospective. Yes.
Thank you.
Thank you.
Any more questions? Okay, thank you so much.